What is the difference between a viability scan and a dating scan? A viability scan, viable, which means able to live. So the word meaning itself tells, in this scan we just look at whether the fetal heartbeat is there or not there. So unless the fetal heartbeat is there, we cannot tell that we have a live pregnancy in the uterus, right? So the first scan which normally is done is somewhere around the 5th or 6th week, just to see if they can see a fetus within or a baby within the uterus. So that is called as the viability scan. So the next question, what is the difference between a dating scan? In viability scan, the baby or the fetal node, as we call it at that particular point of time, is very, very small. So when it is very, very small, of say 1 millimeter, 2 millimeter, dating at that particular point of time may lead to a lot of erroneous measurements and wrong dating. So a viability scan is done somewhere around the 5th or 6th week, or it's probably the first scan which your doctor will say just to confirm that you are pregnant, in which there is no measurements taken. It is just to say that we are seeing the baby within the uterus. And what is the dating scan? That in the dating scan the measurement is taken, and which is done somewhere around the 8th week, 7th or 8th week, and there an expected date of delivery is also mentioned. That is the difference between these two scans. Remember one thing, that the dating done in the first trimester has got, especially using an internal scan, is more likely to be correct date of delivery than any other scan. So viability scan is just a simple screening scan to say you have a intrauterine pregnancy. Right? Why is that important? To confirm the pregnancy is only inside the uterus, because there are rare chances that the uterus is empty and we can see the pregnancy outside, either on the tubes or in the ovary, and sometimes even in the abdomen. Those are rare, but sometimes they can be life-threatening. So that's why a viability scan is just to prove the pregnancy is inside the uterus, and a dating scan is done to date the pregnancy and give the likely expected date of delivery. Thank you.